Before we move on, I want to discuss, we did talk about the guideline update that's just come out.
Right.
Why don't we compare this guideline update compared to where we were? What's the significance of it and how this landscape is changing?
Well, the significance is that it's taken us forever to get this new guideline written, and largely because of a lot of contentious issues around diagnosis and around how to treat patients. But the new guidelines will be different from the old guidelines. Number one, they have now got pediatric specific recommendations in them, which we did not have before. Number two, the quality of the recommendation and the quality of the evidence will be provided for the recommendations under what's called GRADE, G-R-A-D-E. And the two important major changes, I think, are in how diagnosis is recommended to be done and the newer treatment recommendations that no longer put metronidazole out as a first-line therapy.
Okay, we're going to get into that very specifically. Are there recommendations for antibiotic stewardship in these guidelines, or is that something else?
They are as part of the preventive strategy, and I think we've formalized antimicrobial stewardship now as the methodology for trying to basically get people to use antibiotics more appropriately.
You mean you can't just like blast away and hope for the best?
Well, you can, but it won't be good for C. diff.
You know, what's interesting to me about that is, this is one of the very few cases where it's not good for society, and it's also not good for the individual patient. They coalesce right at this point.
Exactly, because we used to say overuse of antibiotics leads to resistance, but that never came back to bite the physician who prescribed the antibiotic. But C. diff is close enough to the time of that antibiotic administration that that patient will associate that antibiotic use with getting C. diff. And that, I think, is one of the important factors to try to at least reduce inappropriate use of antimicrobials.
And that's going to help in a much bigger scope than just C. diff. You know, we've seen the emergence of resistance, but I want to say, you know, when you use when you want to change your antibiotic prescribing habits, thinking about C. diff, thinking about resistance emergence in general, there are really two things that you have to think about. One is reducing the load of antibiotic use in general. And it's not always that antibiotics are being used and, you know, when antibiotics are not needed, they're not going to benefit the patient, but very often antibiotics are being prescribed for far too long. And, you know, there used to be this recommendation, you know, if your doctor gave you an antibiotic regimen, make sure that you always complete the regimen, but doctors really don't know for how long to treat, so they overtreat. But so there are really two factors. One is how much antibiotics you're using, and the second one, which is far more complicated, what antibiotics to use when you need to use an antibiotic. And I think it's important for people to understand that if people are really sick and suspected of having an infection, they need to be treated adequately. And if you avoid using some antibiotics, you're going to use other antibiotics, and just make sure that the other antibiotics that you're using are.
We're going to move on, but I'm going to share a story with you from just last week in my own home. My little girl had a sore throat, and my wife took her to a Doc in the Box because it was quick, right down the street. And they said, we don't think it's strep, but you know, just in case, here's some antibiotics. And I took the antibiotics and I put them in the fridge and I said, just as you did, we're not going there. When the culture comes back, I'll let you know. And of course it wasn't. It was a viral syndrome.